Okay, so this concept of rest, or relative rest as I like to call it, is important. After you've done the RICE, R-I-C-E, rest, ice, compression, and elevation, it's very important to cause no further damage or harm. So the easiest thing until you get care, professional care, is to stay at home, elevate the leg, and stay in a couch or on a chair. Now, some of us don't have such severe an injury, or we're dealing with some chronic problems, and relative rest is important. It's almost like light duty for my workers who get injured. You're allowed to continue with activity, but you just have to maintain on a lower intensity scale. So if I have a marathoner that comes in, or a triathlete, an Ironman that comes in, their relative rest might be running at 9-minute mile pace instead of doing the 4-minute miles. If I have somebody that's used to doing 100-mile bike rides, then perhaps during the time that they're resting or waiting for evaluation, taking care of the ice, wrapping and compressing, or taking their anti-inflammatory prescription or herb, I might suggest that you raise the seat a little higher on the bike and go into a speed that's not so taxing to the joint, but yet you can get a little bit of a cardiac workout in. So it's called relative rest, and it is important to not do any further harm, but it's also just as important to not get too atrophic. Within 1 week of total time off, you can actually lose about 20% of your muscle mass, and that might make for problematic return into sports or activity. So just try to keep that in mind, and if you're unsure, then you always have to consider getting professional help to determine what would be the amount of activity to continue with. Hopefully you'll continue